Hello and happy Friday. Welcome to another episode of Discover with Spinati. Today we're talking about the biggest difference between an implant. There we go. An implant. This is an implant. And your teeth. Yesterday I was having a talk with my folks. I was telling them about the difference between an implant and teeth. And I realized that if they do not know the difference between it, and they don't know the impact that having a dental implant has on your jaw and how you should be taking care of it, because if you don't, then you could lose it. If they don't know and their son is a dentist, then the people that their sons or their daughters aren't dentists, they more than likely don't know. And so I decided to bring this up to you so that you can also benefit from this type of knowledge. Now, in terms of the difference between an implant and teeth, I mean, the obvious is that, the structure of the implant itself is titanium, whereas teeth is not, right? So there is obviously structural differences, but there is one major difference between an implant and teeth, and that is PDL. PDL is periodontal ligament. Periodontal ligaments are thousands of these very tiny ligaments that connect the root tissue to the bone. So those PDLs, those fibers, have more than just an attachment type of function. They have a lot of function. And the biggest function that the PDL has, besides shock absorption and so on and so forth, and allowing you to have what we call proprioception. So when you chew food, you can actually sense the pressure and you can sense where it is and stuff like that. Besides that, the biggest function of the PDL is to actually protect your tissues and to protect your tissues against infection. Because the PDL actually has blood supply, it has immune cells, it reduces cytokines. Cytokines are signaling molecules that regulate your immune system. They have a regenerative reparative process where, if some PDLs are damaged, they can repair themselves. They have a barrier, so they create a barrier against bacteria coming in and creating havoc in that area, and that causes your tooth to last you a very long time. So it's actually very difficult for somebody to lose their tooth. So if someone loses their tooth, that means they've really neglected their health for a very long time. Now, the difference with implants is that implants don't have that, because once an implant is put inside your bone, like so, it becomes integrated. What we call is that osseointegration. Osseo's bone integration, it just means becomes part of. And so this implant, this titanium implant, literally becomes part of your bone. So there is no ligament. There's nothing to actually. Oh, there goes the head of Charlie. Uh, yes, so there's nothing to actually hold the implant in place. And because there's nothing to hold the implant in place, and because the implant is actually fused, the immune cells, the PDL, doesn't have the immunity. There's no PDL. There's nothing to actually help the implant stay in the bone. So now what happens is that you actually have to be a lot more careful in the way that you deal with things, in the way that you actually clean it. You have to be more diligent. So you do have to be, a lot more careful. You have to brush your teeth, because there's a reason why you lost a tooth. Most people lose teeth not because of trauma, not because of anything else, but literally because of periodontal disease or because of cavities, because of an infection. And those happen because of poor oral hygiene. And when you get an implant, you can't do the same thing that you did with the teeth, because it's not as forgiving. Your teeth had that PDL that I just talked about, the periodontal ligament. It is very forgiving. You can go days and months without actually brushing your teeth, or and it'll protect you. But there's a certain limit to it, and then it'll start to kind of go away, because as it starts to degrade and go away, and you start getting, this inflammatory process like periodontal disease. So, what is the best way for you to take care of the implant? The best way for you to take care of the implant is pretty obvious. Is for you to make sure that you're brushing daily. That's number one. Number two is to make sure that you clean around the implant. So flossing is one. And the way that you floss, the way I teach flossing with the implant, is not the same that you do the flossing with regular teeth. With regular teeth, because there's a PDL, because the attachment is different, you can actually go all the way down and past the gum and go all the way down and as far down as possible. And that's what I recommend. But with the implant, you cannot do that. You should stop literally at the gum line. So as soon as you get to the gum line, okay, where the gum meets your porcelain tooth, as soon as you reach there, as soon as you break that contact, stop. And the reason is because the gum, okay, your gum tissue is actually adhered to the implant. Okay, so every time that you break it, you're actually introducing a space so that bacteria can get in. So you don't want to actually break that contact. So you want to stop at the gum line, number one. Number two is you want to use a water pick. And I highly recommend that, because if you don't use a water pick, then you're increasing your chance of bacteria staying there. Again, the PDL have a very protective effect on your teeth. With the implant, you don't have that PDL. So you have to do a little bit of extra work where the PDL was actually there doing the work for you. So now you have to do a little bit of extra work with regards to the dental implant. The third thing that I recommend is for you to go see your dentist at least minimum for every 4 months, minimum. And the reason I say that is because in order for you to keep the implant in your mouth without infection for a long period of time, for life, that's the whole point, is for you to actually see the dentist as much as possible so that the bacteria can be cleared away, so that you don't have something called peri-implantitis, which is the disease or the inflammatory process that happens around the implant when you have bacteria that stay there and wreak havoc around there. So those are the three things that you should be doing in order for you to keep your implant intact, simply because the biggest difference I see, the biggest difference between implants and teeth is the PDL, is the periodontal ligament. And that is it, ladies and gentlemen. That's the biggest difference between an implant and teeth. I would have gone into the different factors that affect dental implants and the longevity of dental implants, but this is not the point of today's podcast. Hope you enjoyed it. If you have any questions regarding dental implants, please feel free to reach out. You can reach out through many different means, either through Instagram or through email, or you can call us on any platform. We're always there. We're even on X, formerly known as Twitter. We're even there. So you can reach out to us. We're here to help you out throughout your journey of oral health. If you have any concerns, please do reach out. And as always, happy Friday and keep smiling.